Sciatica is caused by one of two things. Either the nerve is getting pinched as it's coming out of your spine and creating pain down your leg, or the nerve is getting pinched by a muscle as it goes through the piriformis area. So this is the back of your hip, back of your pelvis. And if you look right here, there's a muscle, it's called your piriformis muscle. And you can see this yellow thing here, that's your sciatic nerve. You can see how close it is. It's right underneath the piriformis muscle. Some people even have this nerve go directly through the piriformis muscle. How crazy is that? So when there's tension in the piriformis muscle, you can see how easy it would be for the sciatic nerve to get irritated. And then you throw in something not quite right with your spine. On top of that, the nerve is going to have a really hard time being happy and healthy. Nerves are very sensitive. You know, if there's any kind of pressure on them, and if that pressure is cumulative over time, they tend to get very angry and will let you know, with either numbness or tingling or pain down the leg, sometimes even weakness. So releasing the tension in the piriformis or stretching the piriformis is a very common treatment for sciatica, and it's very important, and it's a piece of the puzzle. However, if you work on the piriformis, which is in the back of the body, without addressing what's happening in the front of the body, typically your symptoms will be your relief will be short-lived. This is because tension in the front of the hip flexor, the iliacus and the psoas muscle, are directly responsible for tension in the back. You can think of these like a pulley system, where if there's tension here in the front, and that's constant over many, years, days, months, that there will also be tension in the back because your body wants to create a sense of balance and wants you to kind of be held together. So if you've developed tension in your iliacus and your psoas muscle, that pulling forward will irritate the piriformis and has the potential of causing sciatica. Similarly, tension in this muscle will pull the pelvic bone forward, and tension in the psoas in particular will cause a rotation in the spine, which will actually pinch or make the spaces smaller where the nerves actually come out of the spine. So it's a little bit of a double whammy, where you have the nerves being irritated here, as well as back here from that pelvic bone being twisted. So if you're working on trying to address your sciatica, it's very important that you also release the tension in the front of the hip, the iliacus and the psoas, using a tool like the hip flexor release ball or the hip hook to apply direct, prolonged pressure to change that pattern of tension that your body's been holding probably for a very long time.